Climate change is the destabilization of the Earth's climate system. It is caused by an increase in the concentration of greenhouse gases in the atmosphere. Since the beginning of the Industrial Revolution, the levels of greenhouse gases in the atmosphere have increased mainly from the burning of fossil fuels like coal, oil, and natural gas. Climate change is becoming a big issue, especially in terms of the impact it has on human health. Climate change contributes to 150,000 deaths and 5 million illnesses each year. What many believe to be the cause of this is the increasing atmospheric temperature. Between 1975 and 2000, the average atmospheric temperature rose by about 1 degree Fahrenheit. By the end of 2000, that increase was responsible for the deaths of about 160,000 people per year, according to the World Health Organization. The World Health Organization also estimates that 25% of the world's disease is because of contamination of air, water, soil, and food. Although climate change does offer some benefits to health, like fewer deaths due to exposure to cold, the Intergovernmental Panel on Climate Change has concluded that negative health impacts are expected to outweigh positive ones. Some of climate change's impacts on human health include more respiratory irritants in the air, extreme temperature changes, higher risk of diseases, and more frequent natural disasters. Climate change greatly impacts the air quality, which in turn impacts health. There are a lot of respiratory irritants in the air, and a big part of the reason why is climate change. These respiratory irritants include plant pollen and soil fungi. Another respiratory irritant in the air is ground level ozone, which can damage lung tissue and is especially harmful for those with lung diseases. Climate change may actually increase the concentration of ground level ozone. Climate change may also indirectly affect the concentration of particulate matter, or PM, in the air. PM is a complex mixture of extremely small particles and liquid droplets. When inhaled, these particles can reach the deepest part of the lungs. Because of all these respiratory irritants, the prevalence of asthma in the United States has quadrupled in the last 20 years. However, the U.S. isn't the only place that is faced with respiratory irritants. In the Caribbean, respiratory irritants come from dust clouds that originate in African deserts and are swept across the Atlantic by trade winds. Probably the most obvious effect of climate change that affects our health is extreme heat. Average temperatures have been climbing, and those increases lead to more extreme heat waves in the summer and less extreme cold spells in the winter. Heat waves cause fatal illnesses like heat stress, as well as a higher death rate during very hot days. People with asthma, the elderly, and the very young are the most vulnerable during these hot days. Also, heat waves lead to droughts, which can cause crop failure and food shortages, as well as forest fires capable of causing injuries, burns, respiratory illness, and death. Here are some examples of what heat waves can do. In July 1995, a heat wave in Chicago killed 700 people. In 2003, a heat wave in Europe killed about 35,000 people in 5 countries. Also in 2003, heat waves in India killed 3,000 people. Even in Alaska, there have been reports of an increase in accidents from walking on thin ice. Very warm temperatures can increase air and water pollution, both of which can harm human health. Higher temperatures will also increase tropospheric ozone concentrations, which contribute to illnesses that affect the heart and illnesses that affect the lungs. In addition, warmer temperatures are affecting coral reefs. Reefs protect shorelines from storms, but they are suffering from warming-induced bleaching. When a reef becomes damaged, people who live near the coast can be put in harm's way during a severe coastal storm. Climate change is also increasing the frequency of occurrence of natural disasters. In the 1980s, the average number of natural disasters per year was about 120. Now that number has climbed to over 500 per year. More natural disasters can greatly damage human health. An increase in the frequency of natural disasters can lead to more disaster-related deaths, injuries, infectious diseases, and stress-related disorders. Climate change is also impacting the spread of deadly diseases. Diseases associated with hot weather, like the West Nile virus, cholera, and Lyme disease, are spreading rapidly in North America and Europe because increased temperatures allow disease carriers to thrive. Warmer temperatures enlarge the geographic range where these disease-carrying animals can survive. Mosquitoes are probably the most well-known disease carriers. Warmer weather boosts mosquitoes' rates of reproduction, the number of blood meals they take, and it lengthens their breeding season. Because of climate change, more insects and insect-borne diseases are being reported at higher elevations since temperatures are increasing. These diseases are being reported at higher elevations in Latin America, Africa, and Asia. In Central Africa, highland malaria is becoming a big problem. Mosquitoes carrying dengue fever were even found as high as 7,200 feet in the Andes Mountains in Colombia. Diseases carried by rodents can increase during heavy rainfall and flooding. Floods can actually do a lot of harm as far as disease goes. Floods drive rodents from burrows, deposit mosquito breeding sites, and flush disease carriers into waterways. In some places, disease transmission will increase because of higher temperatures. There could also be less die-off of vectors or disease carriers with a warmer winter. In other places, disease transmission will decrease because of less rainfall and temperatures that are too high. Because of climate change, between 20 and 70 million more people could be living in malarial regions by 2080. President Obama has announced that the government is not going to give financial support to the fossil fuel industry. This will raise prices and hopefully motivate industries to look for cleaner alternatives. In 2005, the Kyoto Protocol came into effect. Under this agreement, industrialized countries will reduce their emissions of greenhouse gases by 5.2% compared to 1990. There are actually many things that we can do to help prevent climate change. We can try to decrease the amount of greenhouse gases we generate by walking or biking places whenever possible, carpooling, and using public transportation. Another thing we can do is to turn off lights and other electrical appliances when we're done with them and not use them excessively. Since the most common way to generate electricity involves burning coal, the less electricity we use, the less greenhouse gas gets emitted into the atmosphere.